Well, good afternoon. My friends, this period has been difficult. We've all made great sacrifices. The obstacles we have faced as a province, as a country, and across the globe are unprecedented. And I know that we all feel some uncertainty about what the future holds. But no matter the obstacles, no matter the challenge, your government will stand with you. As Premier, I will always have your back. But it's up to all of us. It's up to all of us to lead, to work with all three levels of government, to work with each other as a province. Alongside our frontline healthcare workers, our essential workers, our spiritual and community leaders, and our business leaders. It's together that we'll inspire hope, inspire innovation, and find solutions. It's together that we will overcome these challenges. This week, our government extended Ontario's state of emergency. Let me be clear, this does not mean that reopening is on hold. We are working around the clock to move ahead with our economic reopening. And as I said last week, our health officials are working on the option of a regional model because we need a plan that recognizes the reality on the ground in different parts of our province. A plan that will help us reopen safely without taking unnecessary risks, because a second wave of this virus is possible. So we must remain vigilant. And we must continue to prepare for the long haul. Back in March, we launched the Ontario Together website. We issued a call to businesses across the province. We called on our business community for reinforcements at a time when we needed them most. Our business community stepped up. We asked them to help us make the medical supplies and equipment we needed. We stepped up the Ontario Together Fund to help businesses retool and switch over production. And since launching that portal, this is amazing numbers here, we've received over 25,000 submissions from businesses across the province. 15,000 of those submissions have led to $200 million in purchases of medical supplies and equipment, 121 million masks, 4 million face shields, 100 million surgical gloves, 20.9 million gowns, straight to the front lines. My friends, thousands of businesses are answering the call. And I want to highlight a few of these innovators who have heard our call for the support. Turlin Construction in Canada, a father and son duo in millwork and cabinetry, have figured out how to make plastic barriers for retail stores. Paul Moyer, an apple farmer in Niagara, is using his apple sanitizer machine to sanitize used N95 masks with a technology that kills 99.99% of germs. True North Printed Plastics in Bracebridge is teaming up with Northern Ontario medical students to make 3D printed face shields. It's absolutely incredible, and it's happening all over this great province. My friends, this is what happens when you turn the manufacturing powerhouse of Confederation to any task. And today, we're recognizing 3 outstanding companies who offer more proof of that. Minister Fedeli will share more details in a moment, but I have to say, our entrepreneurs and innovators are the best of the best. They're the smartest, hardest working people anywhere in the entire world. And we're proud to partner with these businesses to unleash the true power of the sector in our effort to beat this virus for good and ensure that Ontario never again is at the mercy of any other country when it comes to personal protective equipment. Thank you for showing the true Ontario spirit and going above and beyond every day to protect our frontline workers. Thank you, and God bless the people of Ontario. I'll turn it over to Minister Fedeli now.
Thank you, Premier, and good afternoon. As the people of Ontario begin returning to work, The health of workers, our heroes on the front lines, and our communities must remain our top priority. That means ensuring Ontario continues to have a strong supply of personal protective equipment, or PPE, now and in the future. That's why our government is making it a priority to support innovative businesses like Southmedic Inc., Sterling Industries, and SRB Technologies through the Ontario Together Fund. Today, we are pleased to announce that Ontario is investing more than $2.8 million in our homegrown manufacturers to ramp up the production of PPE. Southmed Inc., Sterling Industries, and SRB Technologies are the latest recipients of the Ontario Together Fund. With our support, these innovators will increase their output of personal protective equipment to meet the province's need and help keep our frontline workers and communities safe. Southmedic in Barrie will re-engineer and retool to increase the production of its key products by more than double, and for some products, more than quadruple. This includes oxygen masks and eye and face shields that meet the province's need for PPE. With the support from Ontario, the company will prioritize domestic orders. Sterling Industries in Concord will expand its current production capacity to assemble face shields by increasing its output from about 200,000 face shields per week to 1.1 million. This will help meet a purchase order for 10 million face shields placed by Ontario Health. And SRB Technologies in Pembroke will pivot its production to manufacture medical-grade face shields, which will be supplied to regional hospitals and long-term care facilities. As we restart our economy, our government is taking the necessary steps to make sure businesses can reopen safely. From producing sector-specific guidance documents with our Health and Safety Association partners, to launching a website to provide businesses with information on personal protective equipment suppliers. Since the outset of the COVID-19 outbreak, Ontario businesses have shown incredible collaboration, resilience, and determination to tackle the crisis. We applaud everyone in Ontario as they continue to step up and demonstrate what Ontario's manufacturing sector is capable of. And we encourage all businesses to keep innovating, keep working together, and keep the Ontario spirit going. Thank you.
That's great. Well, before I start, I know so many people out there I talk to, they have it set at 1 o'clock that we come out, and when we're sitting in the legislature, bells start going off from 1 to 2, and that's why we bumped it up to 2, but we want to get back on the 1 o'clock, because there's so many people that I go talk to, and they say religiously they watch at 1 o'clock, so we'll try to get back at 1 o'clock, but we're ready for questions.
Okay, first question.
First question comes from Haley Cooper from News Talk 1010. Please go ahead.
Hi, Haley.
Hi, Premier.
Hi, Haley.
About the hundreds of COVID-19 cases in the GTA that weren't reported to health officials, this has put thousands of people in contact with the virus and not properly traced. So exactly how did this happen? How is it that the hospitals did not know whose responsibility it was to report the case, and how do we know this hasn't repeatedly happened already?
Well, I'll pass this over to the Minister of Health, but I believe the numbers, I just want to tell the public, I think we're over 700 and some odd thousand tests. So I want to thank the public health folks and Ontario Health and everyone out there doing the testing. They've really ramped it up. But I'll pass this one over to the Minister of Health. Thank you.
There were about 700 cases that were not reported to public health due to misunderstanding between the hospital and the lab that conducted the tests. However, that has been rectified to make sure that it won't happen again. Notices have been sent out to the hospitals or the assessment centers, wherever it is that the tests are being conducted, indicating that it is their responsibility to notify public health. But I think it's also really important to note the fact that when people went to the assessment centers, or to the hospital in this case, to receive the test, they were also told that they could receive their results online, and they were told how to go online to obtain that information. So some of them may have been told if they tested positive, that they needed to self-isolate. They needed to make sure that they didn't be in touch with other people. And so we are following up now. We are doing the contact tracing and case management services to make sure that that has been done, and to follow up on any contacts to ensure that they are safe and healthy, or perhaps they need to be tested as well. But this is something that has been dealt with, that all units are aware of the process going forward, and this will not be happening again.
Follow up?
And our follow-up question was, I think it was last week, there was some talk that Service Ontario locations, more of them would be reopening. So we just wondered when we were going to see Service Ontario locations reopen.
Well, first of all, I want to address Service Ontario. I have one across the street from where I live. I just want to tell people, please take advantage of online. You can get vast majority of everything if you just go online. You don't have to wait in line, and hopefully in the next couple weeks we'll have the rest of the Service Ontario locations open, but the vast majority are open. But beat the lineup and just go online, and you can get it a lot quicker. So that's what I'd recommend, and you can pretty well get everything from stickers to plates, you name it. They can go online and get that.
Next question.
Next question comes from Mark Douglas from 680 News. Please go ahead.
Hi, Mark.
Thank you. Question for Premier Ford, first of all. Today we saw another small protest outside the Ontario legislature here. There's a small group of about 30 people. Some of them had their kids with them. And they were rallying in defiance of the state of emergency and subsequent shutdowns. No one in the crowd, of course, wearing masks. And one of an elected official, MPP Randi Hillier, was out there telling this crowd there's no emergent crisis, there is no emergency anymore. This rally is scheduled to repeat tomorrow. I'd like to know what's your reply to this organization and to the elected representative, Mr. Hillier, and to this whole general idea of protesting against the state of emergency.
Well, it's totally irresponsible, and you were telling me I didn't see him, but bringing your kids out there and just going against everything that everyone's been working for. The 14.5 million people work so hard. I'll tell you, Mark, we wouldn't even be in this position if it wasn't for the great people of the province and listening to the protocol of the chief medical officer. And what we're talking, a couple of weeks for stage 2 or maybe sooner. That's up to the health table, but really over that. And then you want to bring your kids and put them at risk. It's irresponsible. And Randi Hillier, that's unfortunate. I'm disappointed in Randi, and he should know better. And I'm just shocked that he'd go out there and rally 30 people. It's a shame. So I wouldn't recommend anyone doing that. We're doing so well as a province. We're seeing the trend go down because of the support of the people. It's just unnecessary. So disappointing.
Follow up.
Thank you. Second question, then again to you, Premier Ford. A number of downtown Toronto high-end stores boarded up their windows last evening in fear of some kind of street riot, and it appears to have just been a reaction to online rumors and spreading of false information. Is boarding up your windows with great sheets of plywood, basically wrapped all the way around the ground floor of the Eaton Centre, or in any case around the Bay and Saks Fifth Avenue, do you consider that a valid reaction to rumors and fears? Is that the way you want Ontario to appear to the world? Would you consider this Ontario sticking together, or what's your general reaction to this?
Well, I understand they might do that, but we're different than the United States. I'll tell you, we're Ontario, we're Canadians. I'm a strong believer in if you want to protest something, you do it peacefully, and you don't get the anarchy in it. But we have such great people here in Ontario. We don't believe in it. We stand together Doesn't matter what political stripe you're from. We've been working together on all three levels of government, and people in Ontario just wouldn't tolerate that. We're better than that, and you know, I understand, but you know, this is Ontario. We're Canadians. We're proud to be Canadians, and we'll always be better than anyone else in the world.
Next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Hi, Brian.
Hi, Premier. You just expressed your disappointment in the people out front at Queen's Park, but some of them are business owners who are wondering when they will be able to reopen. And with the extension of the emergency order until the end of June now, that's a legitimate question. Will they be able to reopen? Not when, but will they? So I'm wondering, you know, what you have to say to them, because while you say a second wave is possible, economic calamity is a certainty if people don't get a chance to get back to work.
Yeah, I hear you loud and clear, Brian. A state of emergency is not going to affect reopening whatsoever. We're going to move forward with reopening. We're looking at a regional plan as well, but that's not going to stop us. We're working day in and day out. I know Minister Fedeli, Minister Phillips, and Minister Elliott, they're all working on a plan to try to get reopened, but we have to reopen safely. And I understand the problems that these businesses are going through, but we're going as quickly as possible. I say it all the time. No one wants to get the economy going more than I do. And once we start, we're just going to, you know, just go full steam ahead. We have a great plan about, you know, telling the people, let's buy Canadian. You know, let's support Canadian companies. Let's support Ontario-based companies. People, until I was Premier, Brian, I didn't realize the economic powerhouse Ontario is around North America. We can manufacture absolutely anything. And do you know who does a good job at this? I'll be frank, or down in the U.S. I spend a lot of time. You always see on their products, made in USA, made in USA. A shout out to the manufacturers. Let's start putting made in Canada, because I know the consumers, even if we switch the buying of even 10%, that's billions of dollars. When we're doing $390 billion of trade, two-way trade with the United States, we're doing $45 billion with China, which $42 billion we're importing from China, and we're only exporting $3 billion. Made in Canada. And I know if we put made in Canada on the shelf, and they're two identical products, and we're competitive, Canadians, Ontarians are going to buy and support the made in Canada. So we're going to be rolling out this plan over the next few weeks, and I'm really going to be pushing buy made in Canada. We're the best in the world. We have the best manufacturing, the best ingenuity, the best engineering anywhere in the world, and we can compete and kick anyone's butt out there when it comes to products that we manufacture here, no matter technology, AI, right across the board. I get excited just talking about it. So we can do it, and we're the best anywhere in the world, right here in Ontario.
When you have said time and again that the people should know what you know. You say it all the time,
Yep.
But when NDP leader Andrea Horwath asked why you would not release the list of which long-term care homes are red, which are yellow, which are green, you didn't even get out of your chair to answer the question. In fact, you ignored all questions today from Andrea Horwath in question period. You didn't answer questions from Taras Nachinchuk. You didn't answer the initial question from Randi Hillier. So I'm wondering, do Ontarians actually get to know what you know? And do you respect the legislature if you're not going to answer questions from the leader of the opposition in what is a very limited sitting at Queen's Park?
Well, like I do here, the Minister of Long-Term Care is a lot more knowledgeable about the long-term care file than I am. I pass it over to the experts. I always say, I've always surrounded myself with experts under their knowledge. Dr. Fullerton's done a great job. He's been a doctor for 30 years, and honestly, when it comes to health, could run circles around me. My expertise is the economy, procurement, supply chain. I'll talk about that all day. I did answer a couple of questions in the ledge, and I'll continue to answer questions. And we're going to make sure the 19 homes that are in red, we're going to be there. We're supporting them right now. We've already taken over the management of, I believe, 7 homes. We're working on an 8th home in Kitchener right now, and as we take them over, I'll announce it. But you have to understand too, and I think the public understands, this is very fluid. They could be red one day and start moving to yellow and green as they fix their issues within a few days, and vice versa. They could go from green to yellow to red, so it's constantly moving back and forth. But you know, let's look at the overall picture. Well over 70% of the homes are being managed properly. They haven't been infected. They're doing a great job. But the hot spots, we're all over right now. We're throwing everything we can at these homes, and we're going to fix the problem that we inherited. But by no means am I shy to answer any question. I just want to make sure the experts, people that are a lot smarter than me in their area of expertise, they can answer it.
Next question.
Next question comes from Morgan Campbell from the Global News. Please go ahead.
Thank you. Premier, I wanted to ask you about your thoughts on the mix-up between the contact tracing, because you have been adamant that, you know, we really get down to the bottom of this, and, you know, this is particularly could be linked to the reason why we're seeing such a spike in cases right now.
Well, what I always like to do is, and I you know, it's kind of ironic. It's by no means is this the media's fault or anyone's fault, but when we increase tests, I'll give you an example. We have 10,000 tests, and all of a sudden the numbers drop to 280, people infected. All of a sudden we ramp that up, almost double it to 18,000, 19,000. Naturally, the numbers are going to go up. So what we really do is we measure percentage. And right now, I think the percentage is 2.9 if we look at it. So we're under 3%. It's going in the right direction. And tracing, we're ramping up the tracing, working with some incredible companies. I believe Shopify, Canada's #1 company now, some of the brightest people, as far as I'm concerned, in the world at Shopify. They're helping us on the tracing side as well. So we're doing everything we can. We're building stronger systems right across the board. And every day, as a province, we're getting stronger and stronger and stronger in all areas.
Follow up.
I spoke with an epidemiologist who says that, you know, this pandemic, a lot of human issues managing it have come to the forefront. He's saying that, you know, this isn't necessarily a scientific problem anymore. It's a management problem, and management problems we should be able to fix. What's your reaction to that, Premier?
Well, I feel we have a great management team. I'll go back 12 weeks ago, and I think this covers everyone in the country and everyone around the world that got hit the same time we did. Everyone's ramped up their programs. Are we in better shape than we were 12 weeks ago? We're in 1,000 times better shape. We're in better shape in the hospitals. As a matter of fact, the hospitals are in better shape than they ever have been, and they're ready to react at any given time. Our testing has gone up. We have a great testing strategy. We're out there with our mobile units out in Scarborough, and we're going to be going around to other areas that need our support there. PPE, as you just heard from the Minister of Economic Development, Job Creation. We had over 25,000 companies come to the table. We're engaging in thousands of companies. So we'll never, ever have to rely on another country again for protective equipment for our frontline health people. And that was a big problem at the beginning when we're relying on overseas countries to ship it in, relying on the U.S. that closed the door on us, which still just really irks me that they would do that in this pandemic. But guess what? We rose above all of them because we just unleashed our manufacturing might, and boy, did it come to the forefront. And that's why I say, moving forward, let's buy Canadian, made in Canada. And I'm going to get on the line over the next couple of weeks, as I have with the Retail Association, with the manufacturers of foods and other goods. Let's promote made in Canada. I don't see it on, be it a cereal box. It might be manufactured here, maybe in Niagara Falls, but put it on the front, and I'll guarantee you, your sales will go up as sure as I'm standing here. Or hand sanitizer. We have great hand sanitizer companies, and one right on the front has the maple leaf, made in Canada. I'm buying that product over one being shipped in from another country. We support each other. We have the population, 14.5 million people, plus the rest of the country. Make no mistake about it. We're an economic powerhouse here in Ontario. And do you know what I'm going to do? I'm going to pass it over to the Minister of Economic Development, and he can tell you some of the successes that we've had here.
Thank you very much, Premier. You know, it's been wonderful to watch these companies, whether it's the auto sector or our manufacturing might that has opened up. We're now making hand sanitizer. We invested from the Ontario Together Fund $850,000 a couple of weeks ago in Virox Technologies in Oakville to make sanitized wipes. We're making face masks. We're making oxygen masks. The announcement we made today with the three companies who are now making oxygen masks, face masks, and all of the products that we need. You can go to ontario.ca/PPE, and that tells you where you can buy your personal protective equipment. And you'll also see the ones that are made in Ontario. There's a flag right on each one of those products that are made in Ontario. So we're showing Ontario spirit because the companies here in Ontario have shown the true spirit of Ontario. Thank you.
Next question.
Next question comes from Cynthia Mulligan from City News. Please go ahead.
Hi, Premier.
Hi,
How are
Cynthia.
you today?
I'm fine. How are you?
I'm well, thank you.
Good.
Yesterday, you started your news conference by saying that there was no place for racism
That's right.
in Ontario. I tweeted it out, and instantly my feed lit up with people pointing out that your government cut anti-racism funding and has also been very slow to respond for calls to collect race-based data on communities that are impacted by COVID-19. Many people, not all, don't feel that you have done enough to address the racism issue in this province and the disparities amongst groups and how they are hit harder than others.
Yeah. Well, let's talk about the funding. First of all, we support the funding to a tune of $5 million, Cynthia, and they didn't spend $200,000 one year, so we kept it the same. We didn't cut it. They didn't use it. So, but by no means are we out there cutting it. We're actually going to enhance it, and I won't tolerate for a second any racism, no matter if it's a black community or any minority community. Never have, never will, and I'll come down hard on anyone who goes out there and talks about derogatory remarks about any community. I don't care who it is. I'll come down like a ton of bricks on them, because we have the most multicultural province jurisdiction anywhere probably in North America. But I won't tolerate it whatsoever, not for a second.
Okay, and would you care to weigh in on how U.S. President Donald Trump is handling the crisis that they are facing right now? Prime Minister Justin Trudeau was asked, and there was a very long pause. Is this something that no Canadian politician wants to be honest about?
Well, it's not honest. I'm honest. I don't have time. I'm being 100% honest. I don't have time to watch the news. I just don't. I'm on the phone till 11, 12 o'clock at night, going 100 miles an hour, and I'm worried about Ontario. That's what I'm concerned about. They have their issues. There's no doubt they have their issues in the U.S., and they have to fix their issues. But it's like night and day compared to Canada and the U.S. I'm proud to be Canadian. I'm proud to be the Premier of Ontario, and I know Canadians just won't tolerate it. And I won't tolerate it, and I'm sure every leader in this province won't tolerate it. So again, good luck to them, and hopefully they can straighten out their problems. And thank God that we're different than the United States, and we don't have the systemic, deep roots they have had for years. When I went down to the U.S., spent 20 years back and forth building the company down there, I said the difference between the U.S. and Canada for the most part, we get along. We all live beside each other. We work together. We share communities. We go shopping. Believe me, it's night and day when it comes to Canada and the U.S. I'm proud to be Canadian.
Last question.
Last question comes from Mike Crawley from CBC News. Please go ahead.
Hi. First to Minister Elliott. Minister, I just received a statement from Ontario Health saying that it takes full responsibility for the positive tests that were not reported to public health. Given that you are the minister in charge of Ontario Health, I'm wondering what responsibility you take for what happened.
Well, there are a combination of factors that resulted in this misunderstanding between the lab and the hospital. It is something that has been strained out by Ontario Health, working with public health to do the case and contact tracing that needs to be done here. We have fixed the situation, and everyone is very clear on their reporting obligations, and that we are supplying the local public health units with whatever supplies and resources that they need in order to do the contact tracing in this particular case, and to do the follow-ups necessary, whether it's extra testing, whether it's self-isolation for another 2 weeks. Whatever needs to be done, we are going to supply those resources to, first of all, Ontario Health, and of course, the local public health units involved.
And if I could follow up with Premier Ford. Premier, you just indicated that one of the reasons for the increasing number of positive tests is because there is more testing going on. But actually, if you look at it over the course of May, there's absolutely zero correlation between the number of tests that are conducted on any given day and the number of positives. It's been completely all over the map. So I'm wondering where you came up with that conclusion, and and what evidence are you basing that?
Before I pass to the Minister of Health, we've seen it when you should be measuring percentage. You know that, Mike, that you measure things on percentage, not just on numbers. So the more you test, you are going to get a little more bump. You're testing 20,000 people compared to 10. There's 10,000 more people that may have a chance of having COVID. It's just simple math. I think it's pretty straightforward. I'll pass it over to the Minister of Health.
I think it's also really important to remember when we started with the outset of COVID-19, the Public Health Ontario was doing the testing. They were able to do about 5,000 tests per day. Clearly that wasn't enough, and so we increased the lab capacity. So there are now over 20 labs that are interconnected, including hospital labs, university labs, and some private labs. We know that we need that capacity to do the testing for COVID-19, and we have gotten it up, for the most part, up to 20,000 tests per day. We know that we need to increase it even further, and so we're going to increase the testing. That's the reason why we have implemented a change in our testing strategy now that we have tested all of the people in long-term care homes and all of the staff. We want to continue with congregate settings. Retirement homes are a next focus. We are going to go back into long-term care homes to do more surveillance testing because we know we need to continue to do that. We want to get to group homes. We want to get to places where people are living together, into correctional facilities. And now with the pop-up testing facilities that we have, we know that we are going to bring many more people in. As a matter of fact, today I was at the new pop-up testing facility in Scarborough, and I can tell you that there were many people lined up to be tested. People want to have these tests. They're concerned about their own health. They may be showing signs of COVID-19, or they may have been in contact with someone with COVID-19 and they want to know whether they're all right or not. People are responsible. They want to know that if they have signs or symptoms of COVID-19 and they do test positive, they know they need to go into self-isolation for 2 weeks. So people are stepping up to the challenge, and we are stepping up our testing by both the number of tests, the number of lab facilities that we have to receive the tests, but also to do the testing itself. And this pop-up facility will go from place to place across Ontario, wherever they're needed.
Thank you.
That's great. Thank you, everyone.